The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Good morning, TMD warriors. It's a Tuesday morning when I usually record my episodes of TMD Demystified. So we are here again. My name is Tony Urbanek. As those of you who routinely watch these episodes, you already know I am an oral and maxillofacial surgeon who is dedicated to the non-surgical treatment of TMD. Today's topic is entitled The Root Cause of TMD. The root cause of TMD. Now, I've spoken on this several times before. Today, I'm going to kind of bring it together from a little different point of view. And that is the science behind developing a root cause of any disease. Because science works extremely well when the rules are applied to use it. It has certain rules in science, and when the rules are used, it's effective and successful, and the rules are not used, it is scientists who call themselves scientists who don't use science don't get the results. It's that simple. But my efforts for 50 years have partially been involved with the determination of how to solve the TMD, temporomandibular joint disorder problem. And it started literally over 50 years ago when I finished my training at Vanderbilt University in medicine. I already had a dental degree, then a medical degree, and surgical training in oral and maxillofacial surgery, fellowship with the NIH, NIDCR, National Institute of Dental and Craniofacial Research, 2 years of my own research project on facial growth and development. And when I finished that series of educational experiences, I came out into private practice, and a large portion of my practice, surgical practice, had to do with fixing the temporomandibular joints, along with a lot of other surgical procedures in facial growth and development areas, which would include orthognathic surgery, facial growth problems, microneural surgery, nerve problems, cleft palate, which is a developmental problem, cleft lip, cleft palate, cancer reconstruction, certainly a lot of trauma reconstruction. But TMD, temporomandibular joint disorder, better known as TMJ, was a huge part of my practice. And over a span of 36 years, I did well over 2,000 temporomandibular joint surgical cases until I decided TMD was not best addressed by surgery, and I went on an investigation to determine if I could figure out what was really going on and why no one at the time had a good handle on this disease, TMD. And I did figure it out by using the scientific method, which is observation and then searching for the cause of the observation. I won't bore you through all the little steps. I have covered it in a general way in other episodes of this podcast. But the observation comes first, and then the scientist looks for the cause of the observation. And sometimes when he actually finds the cause of the observation, there is another cause which causes that effect. So it's a matter of searching cause and effect, cause and effect, cause and effect, like a set of dominoes, sometimes going back to the original cause. And that's one of the descriptions of the scientific method. Nowadays, I think an inordinate amount of emphasis is placed on statistics within the scientific method. Now, again, I don't want to get too deep into that. Statistics has a part, certainly has a place to part to play in science. Statistics are important, but as the quote goes, there are lies, damn lies, and then there's statistics. So statistics can be manipulated and aren't always factual. I could use some examples that would probably upset a few of you out there, but so I'm not going to do it. I'm not here to upset anybody. But I think that an inordinate, at times, emphasis is put on statistics when a simple follow-through of cause and effects wouldn't do almost the same experience and justification. So that is science. And in the medical field, I'll give you a good example. As you know, I do a parallel blog once a week, parallel to my episodes of TMD Demystified on this platform. And this week, the title was Root Cause of TMD. And I'm just going to read a paragraph out of that blog so that I get it absolutely correct, because it is a good example in medicine of following cause and effect, with the observation coming last after the cause, searching for the cause. And a good example of that in medicine is the science behind the root cause of malaria. And I'm bringing this out not to teach you about malaria, but to give you an example of a useful series of cause and effects, observations looking for the cause. Then once the cause is found, then looking at that as an observation, then looking for the cause of that. So it can be a series of dominoes. And a good example is malaria. The symptoms of malaria: high fever, headache, fatigue, dry cough, nausea, vomiting, anemia, jaundice, seizures, kidney failure, and coma, often leading to death, has been known for centuries. It was originally thought malaria was caused by something in the air, thus the name malaria, from the Latin bad air. These are very disparate symptoms and did not have any obvious connection. There appeared to be no common cause until a French army doctor, Charles Alphonse Laveran, in 1880, observed the parasite Plasmodium malaria in the red blood cells of infected North African soldiers. The common denominator, or root cause, of malaria had been found. He was searching. He put some red blood cells underneath a microscope and saw some very small little black spots, which were identified as parasites, Plasmodium, named it Plasmodium malaria, and found the cause of those disparate symptoms was a single parasite. Then it took 17 more years until Major Ronald Ross, a surgeon with the British Indian Medical Service, discovered the mosquito Anopheles as the vector that transferred Plasmodium malaria from one person to the next via their saliva. So a mosquito bite injecting saliva infected with the parasite Plasmodium malaria infected a series of people who ended up with disparate symptoms. I want to emphasize the word disparate symptoms, or the concept disparate symptoms, because it's very similar to what happened in the area on the disease that we know as temporomandibular joint disorder, which everybody calls TMJ. You can see there were several cause and effects discovered before the disease of malaria was fully understood. This was followed by studying the cause and effects of several substances or drugs that had the best effect killing the malaria parasite. The whole process of solving malaria was just a series of effects, observations, followed by searching for the cause. The root cause of malaria is the parasite Plasmodium malaria. That is the root cause, and a very good example in medicine of using the scientific method, cause and effect, to solve a medical problem or a medical disease. Unfortunately, history will show that the doctors who tried to solve temporomandibular joint disorder, TMD, did not follow the usual scientific method of observation, quote, effect, looking for the cause. In 1934, when actually an ENT surgeon by the name of James Costin in St. Louis wrote a paper when TMD was handed down to the dentist by the medical doctors to investigate and solve, the immediate response from dentists was to use dental treatment closest at hand as the solution. So in 1934, an ENT doctor in St. Louis noted that there were disparate symptoms associated with pain and dysfunction of the temporomandibular joint. He did not know all of those symptoms. He just named at first a few. But Dr. James Costin, in his paper, his theory was the cause, his theory now, incorrect for sure. The original theory behind what causes TMJ, TMD, was the lack of dental support, that is, missing posterior teeth. Lack of dental posterior support was his theory as to why the symptoms of temporomandibular joint occur. Now, he was incorrect, but because of his published paper, a series of events then led to the dental establishment being handed off, because who supplies teeth through the posterior jaws, our dentist, was handed off to the dentist to treat and further work on and further do science on, solve. And that's where it all started. So the dentist, instead of using science, they used what was close at hand. Whatever was close at hand was the response that they used. This included oral surgeons who thought surgery was the answer, orthodontists who thought straightening teeth was the answer, and general dentists who thought fixing the occlusion was the answer to temporomandibular joint problems. It was all theoretical. They weren't looking for the cause. They were just using the tools that they had. Additionally, they all prescribed drugs to suppress symptoms. So instead of addressing or looking for the cause, they just saw the symptoms, the very disparate symptoms, and I'll reel them off again for the multiple times that I've done this. The disparate symptoms of TMD are frequent and or recurring headache, earache, jaw pain, neck pain, tinnitus, ringing in the ears, subjective hearing loss, a feeling of fullness in the ears, dizziness, vertigo, dizziness/vertigo, similar but not identical symptoms, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking. Those are the well-known, well-established, well-agreed-upon symptoms, disparate symptoms of TMD. And instead of looking for the cause, the oral surgeons, the orthodontist, and the general dentist, because they were handed this disease to try to fix, just started looking at the symptoms and trying to fix each symptom rather than looking for the cause, the original cause, the root cause. They work from the viewpoint, if the only tool you have is a hammer, everything looks like a nail. Dental investigators were looking for the solution to each of the disparate symptoms of TMD rather than looking for the root cause. That is the history of TMD up until recently, when I discovered, and I'll go right to the point, that chronic inflammation within the temporomandibular joint directly creates each and every one of those disparate symptoms. And I describe in multiple places on our website, other areas on this podcast, in the blog that I write weekly, exactly the domino effect of what occurs from the root cause to creating all the disparate symptoms. And the root cause, spoiler alert, is chronic inflammation within the temporomandibular joint. And because I had a reasonably broad background training in both medicine, dentistry, investigation with investigational degree, scientific degree in cell biology and anatomy, experience with 2 years of research, doing independent research with the National Institute of Health, National Institute of Dental Craniofacial. I had enough viewpoint where I could just use the simple cause and effect scientific routine, starting out with an observation. The original observation that my patients helped me with when I decided surgery was not going to be the long-term solution and the best solution for temporomandibular joint disorder, instead of reading more journals or going to more meetings or listening to more of my colleagues, I started out with a very, very basic original information, which was the patient themselves. If you're studying a problem, you go back to the basic information available to see what kind of observations could be made. So you really start with the patients themselves. If you have a patient with malaria, a good example would be the doctor who, let me get his name again, Dr. Alphonse Laveran, who was just looking for an observation. He was looking and seeing what he could observe, and he observed little black dots in the red blood cells and eventually determined that that was the cause of malaria. So I began with patients, interviewing patients, asking them about their symptoms and what they have observed regarding their disease, what they have observed. And they led me with their observations. They led me to my first observation, and their observation was the following: if I put my finger, my tongue, a pencil eraser between my front teeth and gently bite down, it feels better. That was the original observation. And from that, I began looking for the cause, and actually from that proved that somehow putting something between the front teeth and gently biting down, it helped the patient, because that's what the patients told me. If I put my finger, my tongue, a pencil eraser, a piece of cloth between my front teeth, I heard that multiple times. Out of 24 consultations and interviews, I heard it a dozen times. I decided to put something between the front teeth and see what happens. And then I did another, and then did another. The results were exceptional, which led to the Urbanek Device and protocol. We don't need to go there right now. But again, the scientific method, an observation, looking for the cause. So I had an observation. I did multiple examples. I did multiple tests. I used the patients as a test bed. Most of them didn't know they were a scientific experiment, but the results were extremely good. In fact, extremely good. And then I had to get more scientific, more into the literature, more into the scientific study of the specifics of how the body works. And without going into all those details, it was determined that chronic inflammation within the temporomandibular joint creates each and every one of those symptoms. So that is the story of cause and effect, the effect being the observation. Scientists work actually backwards. You know, the cause creates an effect, and the effect is the observation that a scientist would use to begin looking for the cause. It's that simple. And it applies to any science, not just medicine. I mean, if you're an engineer, even if you're in business and you're in marketing, you are observing things, and then your job is to find the cause so that it is repeatable. I think that's a very good example, actually. And if you can solve the cause, then it eliminates the effect. And so what was discovered was that a very simple device that fits between the front teeth and separates the posterior teeth according to a protocol, which itself is very simple. It's important to follow the protocol. And the protocol starts out 24/7 with this device, except when you eat, because you can't chew with it in your mouth, but you can drink with it in your mouth. Hot fluids are fine. But it takes a while once you begin to unload the temporomandibular joint. Once you unload the temporomandibular joint, the inflammation comes down slowly, but definitely. And as the inflammation decreases, which is the root cause of all the disparate symptoms, then these symptoms begin to decrease. Painful symptoms begin to decrease rather rapidly within the first week or so. Most people will describe a significant decrease in painful symptoms, and the non-painful symptoms, which are tinnitus, subjective hearing loss, and vertigo, go slower because it takes longer for the chronic inflammation or inflammation influence, which is the inflammation exudate or fluids, which get inside the middle ear through the petrotympanic fissure. A little technical information, look up petrotympanic fissure, which is an opening or potential opening from the temporomandibular joint into the middle ear, which is how inflammation gets in the middle ear. And chronic inflammation or chronic inflammation exudates, damage the structures within the middle ear, causing tinnitus, subjective hearing loss, and vertigo. So that is the description of the root cause of TMD, and history will show that for decades, the dental industry and the dentist and the dental schools and the dental professors were going in the wrong direction. They were just trying to treat symptoms rather than searching for the root cause. So the dominoes involved with this disease were able to be described. And these are as follows. There are three circumstances that damage the temporomandibular joint. Three things damage the temporomandibular joint. They are chronic clenching and grinding, which we call bruxism, acute trauma of various kinds, can be auto accidents, it can be bar fights, it can be 4x4s off the back of a pickup truck. Here in Middle Tennessee, horse injuries, falling off a horse, being kicked by a horse, very common injuries that I saw in my career as a maxillofacial surgeon. And functional malocclusions meaning not just crooked teeth, but crooked teeth to the point where it overloaded the temporomandibular joint. That is called a functional malocclusion, are the three causes of damage to the temporomandibular joint, which in turn then creates chronic inflammation, because inflammation within the temporomandibular joint is the response to damage. In a general way, throughout the body, Chronic inflammation is the body's response to damage, trying to heal. That is what chronic inflammation is. Inflammation is the body's response to damage, and when it doesn't heal immediately or within a specific period of time, then the inflammation has not been effective enough and turns somewhat different in cellular type, in exudative type, to chronic inflammation, which in turn can damage adjacent structures. Chronic inflammation, instead of going through a healing process, will damage adjacent structures. That is why damage to the temporomandibular joint in chronic inflammation is a progressive disease, because once it gets hold, the damage gets worse from the original damage. Let's just say it was a traumatic event and you damaged the joint to the point that it wouldn't heal. You had chronic inflammation. The chronic inflammation then began to damage the other structures within the joint, which made the chronic inflammation worse. And the more chronic inflammation, the more symptoms. So chronic inflammation is the root cause or common denominator, creating each of the disparate symptoms of TMD. Unloading the temporomandibular joint with an oral device and protocol that separates the posterior teeth is the best solution for eliminating the root cause. Rather than going after symptoms, you're eliminating the root cause. And when you eliminate the root cause, you eliminate the symptoms. The root cause of temporomandibular joint disease is chronic inflammation within the temporomandibular joint. I hope that I've made my point. I hope I've made it carefully enough that it makes sense to you. I tell my patients all the time as we discuss this problem, as I do a consultation, if I don't make sense, then you need to say, time out, stop. I don't understand. And then either we'll go through it again or we'll go through deeper into what I can help the patients with, exchange information with the patient, and successfully treat this problem of temporomandibular joint disorder. With that said, I look forward to next Tuesday when I'll pick another topic, another way to come at this issue of temporomandibular joint disorder, better known as TMJ, in this podcast, which is entitled TMD Demystified. My name, Tony Urbanek. If you'd like to communicate with me, I'm available at tony@tmjservices.net. If you are a dentist and a potential provider who would like to use this device in your practice, which is patented, FDA cleared, independent university studied, successfully showing statistical analysis of over 3,000 patients, you are welcome to come onto our website, which is www.urbanektmj.com, and find out how you can become a network provider for the Urbanek Device and protocol, and join our team, because once you become a provider, you are a member of our team, and we help you through any of the rough spots so that you can get the same results that we get here in our practice in Middle Tennessee routinely. I look forward to the next time that you visit our website. I'll see you next Tuesday.